The human heart is one of the most remarkable organs in the body. About the size of a clenched fist, it works continuously throughout life, pumping oxygen-rich blood to every organ and tissue. With every heartbeat, the heart delivers oxygen and nutrients that allow the brain, lungs, kidneys, muscles, and other organs to function properly. When the heart becomes severely damaged and can no longer pump blood effectively despite advanced medical treatment, doctors may recommend a heart transplant one of the most advanced procedures in modern medicine. A heart transplant is a surgical operation in which a failing heart is replaced with a healthy donor heart. It is usually considered only after medications, lifestyle changes, implanted medical devices, and other surgical treatments are no longer able to control advanced heart failure. The goal of transplantation is to improve survival, restore heart function, and provide a better quality of life for carefully selected patients. Heart failure does not mean that the heart has completely stopped beating. Instead, it means the heart cannot pump enough blood to meet the body's needs. As heart function declines, patients may experience fatigue, shortness of breath, swelling of the legs or abdomen, rapid heartbeat, dizziness, reduced exercise tolerance, and difficulty performing everyday activities. These symptoms may gradually become severe enough to interfere with normal daily life. Several medical conditions can lead to advanced heart failure. One of the most common is coronary artery disease in which narrowed or blocked arteries reduce blood flow to the heart muscle. Another major cause is cardiomyopathy a disease that weakens or enlarges the heart muscle. Other causes include congenital heart defects, severe heart valve disease, viral infections affecting the heart muscle, inherited heart disorders, and certain long-term medical conditions. Before recommending transplantation, cardiologists carefully evaluate whether all other treatment options have been exhausted. Many patients first receive medications that improve heart function or reduce symptoms. Others may benefit from pacemakers, implantable cardioverter defibrillators, ICDs, ventricular assist devices, VADs, or corrective heart surgery before transplantation is considered. A successful heart transplant depends on finding a suitable donor. Most donor hearts come from individuals who have died and whose families or legal authorization have allowed organ donation according to medical and legal guidelines. The donated heart must be healthy and carefully matched with the recipient to maximize transplant success. Doctors perform extensive compatibility testing before transplantation. Blood type matching is essential, and additional laboratory tests evaluate immune compatibility to reduce the risk of rejection. The size of the donor heart, the recipient's medical condition, and the urgency of transplantation are also considered when selecting the most appropriate donor. Patients being evaluated for heart transplantation undergo a comprehensive medical assessment. Blood tests, chest imaging, electrocardiograms, ECG, echocardiography, coronary angiography when appropriate, pulmonary function tests, kidney and liver function tests, infection screening, and other investigations help determine whether transplantation is safe and likely to be successful. Doctors also evaluate the patient's overall physical and emotional health. Nutrition specialists, psychologists, transplant coordinators, social workers, and rehabilitation experts may all participate in the evaluation process. Patients receive education about lifelong medications, regular follow-up appointments, healthy lifestyle habits, and the importance of protecting the transplanted heart after surgery. Some patients are placed on a transplant waiting list while they wait for a compatible donor heart. During this period, they continue receiving medical treatment and regular monitoring. In certain situations, advanced mechanical circulatory support devices such as ventricular assist devices may temporarily help the heart pump blood until transplantation becomes possible. Modern heart transplantation has advanced significantly over the past several decades. Improved donor matching, refined surgical techniques, intensive care management, and highly effective anti-rejection medications have greatly increased survival rates. Today, many heart transplant recipients return to work, exercise, travel, and enjoy active lives after recovery. Although heart transplantation is a complex procedure, it offers hope for patients with advanced heart failure who have no other effective treatment options. Careful patient selection, experienced transplant teams, and lifelong follow-up all contribute to successful long-term outcomes. In Part 2 we will explore how heart transplant surgery is performed, what happens after the operation, anti-rejection medications, possible complications, rehabilitation, long-term care, and lifestyle recommendations for protecting the transplanted heart. Educational disclaimer. This video is intended for educational purposes only and should not replace professional medical advice, diagnosis, or treatment. Individuals with heart disease or questions about heart transplantation should consult the
Heart transplantation is a highly specialized operation performed by experienced cardiothoracic surgeons. During surgery, the surgeon opens the chest through the breastbone to access the heart. The patient is connected to a heart-lung machine also called a cardiopulmonary bypass machine which temporarily takes over the function of the heart and lungs by circulating oxygen-rich blood throughout the body while the heart is being replaced. The diseased heart is carefully removed, leaving portions of the major blood vessels in place. The healthy donor heart is then positioned inside the chest and connected to the recipient's major blood vessels using precise surgical techniques. Once all connections are complete, blood flow is restored to the new heart. In many cases, the transplanted heart begins beating on its own. Occasionally, doctors may use temporary electrical stimulation to help establish a normal heartbeat. After surgery, the patient is transferred to the intensive care unit, ICU, for close monitoring. During the first few days, doctors continuously monitor heart rhythm, blood pressure, oxygen levels, breathing, urine output, and the function of the transplanted heart. Blood tests, chest X-rays, echocardiograms, and electrocardiograms are performed regularly to ensure the heart is functioning properly. One of the greatest challenges after a heart transplant is preventing organ rejection. The immune system naturally recognizes the donor heart as foreign tissue and attempts to attack it. To reduce this response, patients must take immunosuppressive medications commonly known as anti-rejection medicines, for the rest of their lives. These medicines greatly reduce the risk of rejection and improve long-term transplant success. Because immunosuppressive medications weaken parts of the immune system, transplant recipients have a higher risk of infections. Doctors may prescribe preventive medications against certain bacterial, viral, or fungal infections and advise patients to practice good hygiene, avoid close contact with sick individuals, and attend regular medical follow-up appointments. Doctors also perform heart biopsies during the months following transplantation. During this procedure, a small tissue sample is taken from the transplanted heart and examined under a microscope to detect early signs of rejection. Since rejection may develop before symptoms appear, routine biopsies help doctors identify problems early and adjust treatment if necessary. Like any major operation, heart transplantation carries potential risks. Possible complications include bleeding, infection, blood clots, rejection, kidney problems, medication side effects, abnormal heart rhythms, or narrowing of the coronary arteries within the transplanted heart over time. Fortunately, careful follow-up and modern medical treatments have significantly improved the management of these complications. Recovery is a gradual process. Most patients remain in the hospital for several weeks while doctors monitor healing and adjust medications. After discharge, patients participate in cardiac rehabilitation a structured program that includes supervised exercise, nutritional counseling, education, and emotional support. Cardiac rehabilitation helps improve physical strength, heart function, and overall quality of life. A healthy lifestyle is essential after transplantation. Patients are encouraged to eat a balanced diet, maintain a healthy weight, exercise regularly according to medical advice, avoid smoking and recreational drugs, limit alcohol if advised by their healthcare provider, and manage conditions such as diabetes, high blood pressure, and high cholesterol. Taking medications exactly as prescribed is one of the most important factors in protecting the transplanted heart. Regular follow-up visits remain necessary throughout life. Doctors monitor heart function, medication levels, kidney function, blood pressure, cholesterol, blood sugar, and overall health through physical examinations, laboratory tests, echocardiograms, and other investigations. Early detection of complications often allows prompt treatment and improves long-term outcomes. Advances in transplant medicine continue to improve survival and quality of life. Better surgical techniques, improved donor matching, more effective immunosuppressive therapies, and ongoing scientific research have enabled many heart transplant recipients to return to work, travel, participate in physical activities, and enjoy meaningful, active lives for many years after surgery. A heart transplant is not simply the replacement of an organ. It represents a lifelong commitment to medical care, healthy living, and regular monitoring. With modern healthcare, careful follow-up, and strong patient participation, many transplant recipients achieve excellent long-term outcomes and experience a significant improvement in daily life. Educational disclaimer. This video is intended for educational purposes only. It should not replace professional medical advice, diagnosis, or treatment. Individuals with heart disease or transplant-related concerns